Hi everyone, my name is Fariba Panohi and today I will be presenting my case study on abnormal uterine bleeding. This is abbreviated AUB. Patient presentation. Rita Snyder is a 44-year-old previously healthy woman who presents to the emergency department with heavy painless vaginal bleeding that began 6 months ago when her menses became irregular. At first, she noticed a spotting between her menses and heavier periods. This has now progressed to continuous vaginal bleeding over the past months, with especially heavy bleeding for the past few days. She is soaking through 10 pads per day, and she reports that she is constantly on guard and anxious about this problem at work and at home. She feared that the problem may be related to menopause. She has been pregnant twice in her 20s, which resulted in vaginal deliveries of two healthy children. She is taking no medication. The menstrual cycle, which is counted from the first day of one period to the first day of the next, is not the same for every woman. Menstrual flu might normally occur every 21 to 35 days, but it can be vary from 24 to 38 days based on some diet change, mental and physical condition. And the usual length of menstrual bleeding is 4 to 6 days. However, 7 to 9 days also considered normal for some cases. And the usual amount of blood loss per period is 10 to 35 milliliter, but this amount can be affected by various factors and change from 5 to 80 milliliter blood loss, which that consider normal. Based on these normal ranges, variation in any of these parameters constitute AUB. Abnormal uterine bleeding, or AUB, was traditionally called menorrhagia. The research standard for menstrual blood loss was greater than 80 milliliter. Abnormally heavy and prolonged bleeding with menstrual blood loss of greater than 80 milliliter is defined as menorrhagia or AUB. Abnormal uterine bleeding is a symptom, not a diagnosis. The term is used to describe bleeding that falls outside population-based 5th to 95th percentile for menstrual regularity, frequency, duration, and volume. AUB is a common concern. However, most women don't experience blood loss severe enough to be defined as menorrhagia. Abnormal bleeding is considered chronic when it has occurred for most of the previous 6 months, or it considered acute when an episode of heavy bleeding warrants immediate intervention. With menorrhagia, individuals cannot maintain usual activities due to so much bleeding and cramping. Uterus location and function in female reproductive system. Uterus is a hollow, pear-shaped organ whose lower ends open into the vagina. Uterus anchors and protects a fertilized egg, provides an optimal environment while the ovum develops. Uterus contracts to push the fetus out at birth. Also, uterus plays an important role in sexual responses and conception. Abnormal uterine bleeding may occur at any age during the reproductive years. It is mostly because of irregular ovulation. More than 50% cases of AUB occurred in premenopausal during the age 40 to 50. AUB counts as 33% of gynecologic visits. Up to one-third of women experience abnormal uterine bleeding in their life, and this is very common at menarche and premenopause. Um, Etiology of AUB are irregularly or abnormally ovulation, low level or lack of progesterone, increase and excess of estrogen, and the thickness of innermost lining layer of the uterus. There is some medication that can cause AUB, abnormal bleeding, which I have listed some of them on this slide. The differential diagnosis of abnormal uterine bleeding is presented as coagulopathy, dysfunction of ovary, ectopic pregnancy and abortion, chronic or acute endometritis, and also the structural abnormalities such as uterine fibroids, uterine polyps, and adenomyosis. There is some condition that can cause abnormal uterine bleeding, which I'm going to briefly describe three of them. Um, so as you see the uterine polyps on the left side of the slide, these are the small benign growths of the lining of the uterus, which may cause heavy or prolonged menstrual bleeding. Um, Intermenstrual bleeding is the most common presentation symptoms of polyps, but many polyps are asymptomatic. Physical examination findings are typically unremarkable, except for cases in which the polyps prolapse through the cervix. Although polyps can develop into malignancy, approximately 90% of symptomatic polyps are benign, um, and the risk of malignancy is even lower in premenopausal women. Uh, and the adenomyosis. This condition occurs when glands from the endometrium become embedded into the uterine muscle, often causing heavy bleeding and a painful period. Um, the prevalence ranges of adenomyosis are from 5% to 70%, and its association with abnormal uterine bleeding is unclear. Many patients are asymptomatic with adenomyosis, but those who have symptoms typically report painful, heavy, or prolonged menstrual bleeding. And also the examination may display a dense, enlarged uterine. And the next one is the leiomyoma, which is called fibroids too. Um Leiomyoma or fibroids are non-cancerous or benign tumors of the uterus that appear during the childbearing years. Uterine fibroids may cause heavier than normal or prolonged menstrual bleeding. Uh, and leiomyomas, which I said are benign tumor, and their prevalence increases with age. Um, Fibroids are eventually found in up to 80% of women. Most fibroids are asymptomatic, but bleeding is a common presenting symptoms and typically involves heavy or prolonged menses. And the larger leiomyomas are more likely to be associated with abnormal uterine bleeding. 90% pathophysiology of AUB, abnormal uterine bleeding, is an ovulatory, which is the loss of cyclic endometrial stimulation, elevated estrogen level stimulate endometrial growth, no organized progesterone, withdrawal bleeding, endometrium eventually outgrows blood supplies, breakdown and slugs from uterus, and also the ovulatory pathophysiology of AUB is a luteal phase deficiency. Um, and also another pathophysiology of AUB can be malignancy of the vagina, cervix, uterus, and ovaries, and some of the systematic disease such as hematologic disorders. These are some of the anovulatory causes of AUB that you can go through them, which I already defined and talked about some of them in the previous slides. The risk factors for the AUB can be women with age 40 or older, a patient with diabetes or obesity history, and a woman with a chronic and ovulation or infertility, unopposed estrogen therapy, thyroid disease, hypertension, and also history of breast or colon cancer, history of endometrial hyperplasia, and also a patient with polycystic ovary syndrome. Some of the symptoms of the AUB is the bleeding for longer than a week, excessive menstrual blood flow, and also passing large blood clots. There is some complication that patient with AUB um, might go through. Uh, it's restricting daily activities due to heavy menstruation, anemia-like symptoms such as breathing difficulty, fatigue, and tiredness, and also soaking through one or more sanitary pads a day. Pap smear test is a very important consideration for the woman with age 21 and older, uh, which can screen for cervical cancer to prevent any abnormal uterine bleeding, such as AUB. There are many ways for the treatment of AUB, abnormal uterine bleeding, but medical management is the first line approach for the most patients to avoid surgical risk and preserve fertility. However, a wider range of surgical options are available for treatment of non-emergent uterine bleeding as well. And there are some more treatment that you can go through of them for the extra information.